Hi everyone, thank you so much for watching our video. I want to say my video, but it's our video. We are here to make a little Q&A about physical activity training during pregnancy. I have here with me my pregnant client and my lovely sister, Louisa. Welcome, Louisa.
Hello.
How are you feeling?
It's really great. Thank you. And you?
I'm good, thank you. I would like to see our kubush, if we might.
Yeah,
As a
we
proof
have,
also that we're not cheating here.
we have Bali.
Yeah, our lovely couple is coming. Yes, great. Thank you so much again. So as I mentioned, it's going to be a bit of Q&A about a physical activity which you have started during pregnancy, why we should perform any, when, trimesters, what to avoid, what not to avoid, and a bit of insight on a few tips, general tips for ladies.
Yeah, great. I think it's good to mention that I'm here, and also we're just making that video because I had a lot of question in the beginning of my pregnancy, and I just call to Paulina every time what I can, what I cannot, what should I do, and we just told Paulina just told that this is a great opportunity to make that, because the woman as me is a lot of in our world. So it's great, as she's very experienced and well trained in that topic. I think she should mention about that now.
Oh, yes. So I am a certified personal trainer and I work in the private personal training studio in the central London. And I got my pre and postnatal qualification more than a year ago. And this year I got another advanced wellness practitioner from Jenny Barrow Education for pre, postnatal, and afternatal ladies as well. So Jenny Barrow Education is the most recognized school in UK, which goes really in depth with their courses. So that's me.
Yeah, that's sounds nice, very nice. And okay, so maybe we just start from my very first question.
Please.
Why we just talk about the activity or the training during pregnancy? Why this is so important? Why I see that everywhere in every magazine, every parent pages or something like that. So why I just need that?
Yes. So physical activity, first of all, like to make sure that we don't mean by that only running, only doing CrossFit or going to the gym, doing classes. It's much more than that. Physical activity is also just going for walks, doing like some dancing classes, I don't know, cleaning the whole house or running with your kids. Everything what's activity will be physical activity, right? Unless if it's brain activity, you know what I mean. Nevertheless, the stronger mom to be, the stronger body of her is. And labor, let's be honest, it's a traumatic event in our life, for our body. Of course, it's a beautiful event for our life as a human beings, right? But for the body point of view, it is a trauma, because it's huge effort, the labor. And if mom is strong, then the labor possibility will be shorter and better. Of course, there's some complication always might occur. We can't control it fully, but might be shorter, stronger, and recovery will be probably shorter as well. Not to mention that we are coming back home with the little human being we need to take care of, and we need to lift the baby, we need to lift the pram, often we need to push the pram, we need to pull the pram. So it's all of movements we are training with our coach. Push, pull, lift, squat, lunge, lift the baby from the floor. So we talk about general strength for the quality of life, just simply for the quality of life of mom to be, and the strategies we can learn, teach mom, the mom can learn against the pain, because lots of moms to be develop some kind of pain, especially in the lower back area, in the hip area, shoulders area. So there are some strategies you can apply, and certainly just general movement will help to reduce it or delay it.
Yes. So as always, we just making that for our future.
Yes. Just being smart. Or if really pain put you in the situation when just like, I can't cope with my lower back pain. That's also the situation when the moms ask for help. Unfortunately, but yes.
Okay, so the deal with the normal daily pregnancy pay a little bit also.
Yes,
So
certain.
I can do something to make myself better.
Exactly.
Yep.
Ease the pain.
Yeah. Okay, so I think we have now why.
Yeah.
So we can just move a little bit to what. So, okay, I understand your point of view, or not even your point of view, but general point of view, why this is so important. And I want to start training. So what's the first thing I should do? I just can stop and go running, or just open some fitness activity on YouTube, and this is okay?
Yeah. I mean, certainly not. Always, first thing, we need to get the consent from our doctor and clarification. Check, always, always. I'm not trying to play, and none of the trainer, trust me, no one is as smart as us. You always need to check with doctor. Get the green line, if everything is fine with baby, if everything is fine with the pregnancy, if the mom. So consent from the doctor. Once we get the green light, then I would really, I'm gonna bring it up now. Go to also women's health physio during the second trimester. We're gonna probably get to this more in depth later on. But doctors is the first thing. And once we get this, we simply ask ourselves how we feel. Because during the first trimester, you might feel really nauseous, really tired. And the last thing you like to do is any kind of activity. So just listen to your body. After doctor's
Okay.
appointment, we just simply listen to our body.
Okay, so do not put any pressure on yourself. So if I don't feel very well today, it's fine. Yes.
It's completely fine.
Okay. And what about situation that I have red light, so I cannot train? I need to lay in my bed on our couch due to health reason. So what's then?
Yes, so it is very sad situation. I'm really sorry about that if that happened to any mom to be, but sometimes we need to see the bigger picture, right? And okay, we're lying in the bed or sofa, we cannot even go for a walk when we prescribe to lie down. There is still something we can do to ourselves. It's breathing strategies to practice our breathing, because if we talk about breathing during the pregnancy, because little human is growing in our belly, pushing our diaphragm and all of our organs aside, which means that the future mom start to bring more chest, which means like my chest is lifting, right? And my shoulders and chest are lifting. And we want to breathe more to the diaphragm, which means more like belly area. Yes, inside through the nose. You place lying down. You place your hands on your belly area, just under your boobs line, and you through the nose breathe to the moment when the belly lifts a bit. I'm gonna lift myself and sideways. Yes, so we want to practice this diaphragm breathing, lower costal breathing, which actually gets a bit pushed aside, like the pattern it's not so efficient anymore during pregnancy. So this is the thing which we can safely practice, and other breathing techniques which we can talk to midwives and doctors if we could introduce something what can be helpful more around the labor, but
Okay.
it's not my scope of practice. Yes.
Yeah, so great that we can do at least something, yeah, for
Definitely.
Great. So in a little bit better situation, so I have green light for from the doctor. So this is the healthy pregnancy. I can make some activities, but before pregnancy, I was a little bit more couch potato than the fit lady. So what you recommend in that situation? You can just start
happy.
Or
again, certainly not. Happy days. You can do something. You don't need to lie down, right? From my point of view as a trainer, it's always happy day. But similar like before, and I will always say it, always get consent from your doctor. Like none of the trainer yourself, no one knows better than your doctors, right? So once you have this consent, everything is fine, but you haven't been training before. First trimester is the trimester which is the most teratogenic, and it's actually the most intense, I would say, growth during the pregnancy. It is the most intense growth during the pregnancy, which means everything gets really fragile. If you haven't been doing anything before, start with just walks, 20, half an hour, 40 minutes walk, depends how you're feeling. Just don't push too much pressure on yourself. So daily walks, practice the breathing. You can introduce gentle stretches, which I don't really want to name some because it depends on the person. I would really reach out to some to me or some other practitioners. But stretching gently your chest, keeping your lower back hips nice and flexible, mobile. You can gently open your chest with the pull apart exercise with really light TheraBand. And I would just keep it for now and focus on resting, because how did you feel during the first trimester?
It was not so good.
Yeah.
It was the days then I just lay on the couch or on the bed and just saying, just don't talk to me. I just lay here all day. But
And that's
starting
perfectly fine.
with all the time. So
Mhm.
I think that it's good to mention that we can just go for a walk, just
Yes.
short walk, and it's completely fine. Yeah. So we
Yes.
just did something for ourselves.
Certainly. And if you don't feel like go for this walk, that's
Yeah.
fine too. It's not like, oh, Paulina saying you need to go for 20 minutes. Not at all. As I mentioned, listen to your body. If you feel nauseous and you feel sick, if you feel like really bad, just focus on your recovery, focus on your breathing, focus on yourself. And one day, maybe you'll feel strong enough to go for a walk. And once this first trimester pass, probably the second trimester is very individual, but often it's the time when the women feel like much better, like strong, and they almost can do anything, right? I'm like, I can do it. And this is the time when we can step up a notch in our activity. uh, how intense activity for someone who didn't train? We always look at the scale 1 to 20. 20 is like, I can't go any further, like I can't breathe, everything burns. 1 is lying on the sofa or sitting. So pregnant lady wants to be around 15, 16 on the scale of effort. So you still should be able to have some kind of conversation with someone. More difficult, but you could talk to me and breathe at the same time, because that's the most important. Wherever you do, you need to keep breathing. Bring oxygen to your body. That's the most important. So all the time keeping this nice diaphragm breathing. And then you can do aerobic. Maybe you can go to brisk walks, something what's really vigorous. You can do some Zumba. Maybe you can do some ladies are cycling if they're comfortable with their gravity, center of gravity. You can do gymnastics. But again, I would really reach out to the trainer who has qualifications. So the person can really give you some training program for pregnant lady precisely.
Yeah. So it's suitable for you generally, not just for everyone, but for
Yes.
you.
Yes, certainly. It won't be the time, for maybe starting something really excessive new for you, especially in the first trimester, but activity is like a sign for you always, always.
You just mentioned about, for example, gymnastic lady or cyclic activities. So when I was a fit lady before getting pregnant, so I just trained a lot, for example, for a year. Before that, can I just continue that, or I need to change something? I need to cancel some exercises, add some exercises. How do you feel that?
So again, always consent from the doctor, always, even though you're a professional athlete. And
Always
trust me,
the first point.
yes, always. But even trust me, these professional athletes, they do it. They get consent from the doctors. They know what they're doing, which leads me to another thing. They've been training like that for years. Really, we look sometimes the whole life, like 15 years, 5, 10. So we can see ladies running till the 8th or 9th month of the pregnancy. Fine. because they have been running before for long years and they know what they're doing. CrossFit, they continue. Maybe it's not the time definitely for doing your PB, personal best records, but if you've been deadlifting 150, you can keep deadlifting 190. If you've been deadlifting 50, you can keep deadlifting 30, 35, 40 kg. So you still can definitely work hard within this 15, 16 point on the scale with the movements you're like comfortable with. And if you've been it's like coming back to this running and CrossFit because it's very well rounded. But if you've been dancing or just going to the gym and following the bodybuilding program or anything like that, you can keep going. You can really, running is safe. The child is in the little bubble, and really you can run if you've been running before. I wouldn't start if you haven't done it. It's not time to start, but you can continue.
But I think this is good that you mentioned under supervisor. So just don't go yourself for everything. Please be with contact with your doctor, your trainer, and be sure that this is suitable and also healthy for you. Yep.
Yes, for you and for your baby, because now you're like responsible not only for yourself, but for two at least. I mean, two, because to be fair, like twin pregnancy is one of the contraindications for the physical activities. If you look deeper in this one.
Okay, so twins are not so physiological pregnancy, yes?
Yes, they not consider, like from the definition, they not consider physiological. Like yes, of course, you're not saying that's something wrong, but it's just much more effort for the body and much more things can go wrong. So just by the definition, they not consider a physiological pregnancy. Yes.
Yeah, of course. But of course, we can also we can back to the first point, go to the doctor and take the
always.
Yeah, so,
always. Don't play smart.
Yeah,
don't play smart. But yes, definitely. Just summing up, you can keep doing what you've been doing. Basically, maybe some sports. Yeah, I could mention that some sport are not definitely allowed. Even I would say like scuba diving is not definitely allowed, but I think that it's common sense. Or rock climbing, or rugby, anything like contact sport like judo, karate, when we throw on the floor. But I think it's common sense. But okay, I feel like I should mention it, right? So contact sports, scuba diving, rock climbing, everything when you can fall. So like high jump, like with you're jumping, like about the things. Maybe it's not the best time when you can fall, right? But yeah, I believe it's common sense.
Yeah, as you mentioned, we're just responsible for two.
Oh yeah, and horse riding also, like when you like horse can really throw you off your back. But let me say one thing: if you will see the pregnant lady who is doing that, don't judge them. It's really their choice. So they are taking responsibility. Like just let them be, I would say.
Okay. So I have the question. I know from you lots of information from you, but I also had a conversation with one of my pregnant friend lately, and I just mentioned about the pelvic floor muscles. Yeah, this is a famous topic for now, and could you please explain us something more about that? Why this is so important? Why we just say about it during pregnancy and after, and why this is needed in our body, especially?
Yes, pelvic floor muscle is a muscle complex. Just to mention, men also do have pelvic floor muscle as a woman, just different anatomy, of course. But it's a muscle complex on which you can think like hammock, like a net, which sits in our pelvis, like a name tells us. And on this net, on this hammock, imagine that all of our inner organs, which are lower, sitting, which is like bladder, uterus, cervix, and then bowel is coming also from the side, and then growing, of course, placenta and uterus. They are all sitting on this hammock. And the hammock, like any hammock, has capabilities, right? It could be, I don't know, 150, 20 kg for hammock. Depends on the material, depends on the strength, on the structure, etc. Same applies to the pelvic floor muscles. If we have weak pelvic floor muscles because our muscles are weak for some reason, there are plenty of reasons, right? And we put pressure, and growing baby, which will be at least 10, 15, depends, kilograms more, everything sits on this poor hammock. And then if you didn't train it before, it's been weak, pelvic floor muscle, and you're pregnant and you start running, how much pressure does it put? Or like you start lifting and breathe wrongly and creating additional intra-abdominal pressure, like holding your breath in. It all just creates more and more pressure on this hammock, which attachments like ligaments just go longer, strain, same as the muscle on its own. So it's crucial to go to women's health physio on the second trimester and check how strong, or maybe overactive, that's very important, might be overactive, which also makes it weaker actually, overactive pelvic floor muscle is. Check what's going on, and it can be done only like by the vaginal check. So with the fingers, if I have to describe it inside, or the ultrasonography. So they check how strong it is, overactive, what's going on inside. They can prescribe some exercises, teach you, and then I get this information from the ladies, so I know how to also implement it in the workout. And it's crucial because this pelvic floor carry all of our organs and control our urine and our number 2, our poo distribution. And too many women are leaking after, or I mean during pregnancy, maybe shouldn't as well, but can happen, but especially after. Too many incontinence from both bowel and urine point of view. It can develop also after some time. So if you heard it from your mom, if you're hearing it, it's not normal. It's not normal to leak in the 50s or 60s. It is not normal, and let's start to speak about it out loud. We should not be leaking when we're sneezing, coughing, running, walking, or lifting something heavy or jumping. We should be not experiencing any pain in this area. Also, what brings me, we should not experience pain during the sex, which also One Health Physio can help with. They really, sometimes they're magicians.
Yeah, I think this is great. You just mentioned about that because we just sometimes live in the bubble that you're a pregnant lady, so the leaking is normal. Often pregnant leaking is normal because you were.
You had a baby, what you expect, right?
Yeah, so we should focus on that this is not normal situation, and we can do something with that. And we need to check that in the professionals, yeah, as you mentioned.
Yes. Always.
Great.
Always. And during pregnancy, second trimester, after pregnancy, wait at least the 6-8 weeks. Let your potential scar or just organs heal a bit, and then definitely check and find out some strategies for you.
Okay, so for every pregnant lady, just put on calendar the second trimester, and after the pregnancy.
Yes, it should be a gift from the husband if you can't find or from the whole family for the baby shower. I'm honest, like seriously, just it's a huge investment in your health, which is the most important, and the sexual health. So it's important for husbands. So they could really pay.
Good point.
Good point. Very good point.
I think I just moved to the topic we just always want to have when we just talk with the trainers. So could you give me some magical pills, the magical training patterns, some universal exercises which I can do during pregnancy?
Oh, certainly. Here we go. Yeah, I will be a millionaire by now. No, when it comes to pregnancy, as the training in general, but pregnancy and after pregnancy especially, but let's talk about pregnancy, there won't be one fit for all. There is no such a thing, because I need to know the health conditions of the mom before pregnancy, during pregnancy, the history of the previous potential pregnancy, the lifestyle, work, no work, other kids, support, help, no help, what's going on with the woman and the fitness level of the lady. So it's so many things which factor to what we are doing with the lady. We are, as a trainers, trust me, we really don't want to stand there and tell you 10 more. It might look like that from you sometimes, but we are there to, each exercise has a reason. So we are doing band pull aparts because we want to strengthen your upper back, your rotator cuff, want to open your your chest, want your posture to be more upright. But I'm not gonna tell you this every single time because we're like, I just want to train. I'm not curious, right? But there is why behind everything. But the few tips I could give to any lady is standing up from the bed, from the sofa, from the floor, as well as getting down, which we always get through the side, never like flexing forward. We don't want to do that. We go through the side, lifting ourselves. Exact video of that is on my Instagram, which I link, I post the link under the video of it. I really made a explanation and video how to do it. So it's a one thing. It should be like, even woke up 3 a.m. standing through the side, not even think of it. Another thing is mentioned breathing technique, right? So practice your diaphragm breathing, whatever you're doing, wherever you are, all the time, all day long, just practice. Going to the One Health Physio as that as a part of the training, I consider it part of the training because then I'm asking the lady or the physio what's the outcome and I can incorporate into my training. Other part would be sitting with the support, either special chairs or always pillow behind your lower back area to support it. Another another exercise thing to do, being on your forearm as in the evening or during the day if you experience too much pain on the pelvic floor or your lower back area. It's an exercise approved by the physiotherapist and it's safe. You on your elbows, forearms, and your knees with the bum up, and it's the position where your pelvic floor is resting. After carry all of these kilograms during the day and all of this pressure, is the resting position. So I would really strongly encourage you to do it like every evening for at least 5 minutes, as long as you need to do it, as long as you're comfortable to do it. Another thing would be our posture, which could be another whole video about this. Our posture during pregnancy is changing a lot. So the gravity, the muscles, everything works differently. And it's quite complex issue. In our language, we've got upper and lower cross syndrome. You might have heard that, but the biggest change you probably see yourself is slouching shoulders, so cross chest, belly going forward, bigger lordosis, and our knees going inwards because of our arches in the feet flattens. So whenever you're gonna pass next to the mirror or remind yourself, we're really trying to remain upright, which means from the slouch position, really try to open yourself, so shoulders to the back, stand nice and tall, and on the soft knees, not on the really overextended local knees, just soft pelvis, not here, under you. This will really align you. We call it alignment. So if you look at someone from the side, should be one line going through the ear, shoulder, hip, knee. Just fairly aligned. I know that everyone knows what does that mean. Like mutual tips for everyone. And then if you have green line from the doctor, if you're athlete, professional athlete, you know what you're doing. I'm gonna kind of leave this out. But from the association, actually international, over UK, it's NHS and American Association for Obstetrics and Pregnancy, 150 minutes of cardio, vigorous activity, and 2 resistance training a week.
I think this is a quite big number.
You wouldn't expect that, right, from the pregnant lady, but this is perfectly fine and prescribed, and if the pregnancy is perfectly fine and healthy, 150 minutes of vigorous activity and 2 resistant training. But vigorous activity can be also just going for a brisk walk.
Yeah, but I think this is great that you just mentioned about the breathing, some mobility stretching as a training, because in my imagination before, and also imagination a lot of people, when we think about the training, we just see the gym, the lots of heavy stuff. When I'm red, I'm almost I almost breathing, almost dying there. and we need to face that that could be a little bit different training, and still this is a training, and we just secure our health for the future.
Yeah, I think that we all a bit guilty of it, social media and trainers and the newspapers, that when you say physical activity training, you just have this picture in your head, like you just mentioned, especially someone who didn't train before. But it's much more than that. For someone, it will be like really going for a walk as a training. For some people, stand up from the chair 5 times will be training. So that's again, like trainers, the qualified trainers, we are here for you to find strategy for you, for your fitness level, for your life, for your comfort, help you. We are there to serve you the fact and help. And really, please talk to ladies. Like, you should not be scared. We can make it fun, we can make it comfortable, we can make something what you like. It's not like we always make you things you hate. Maybe you just simply will like some things less, more, and we can always find a consensus about this. Which, yeah,
Great.
yeah.
I think this is great for especially for the beginners, because we have like, no, I don't go. I will not start because this is very scary and will be very heavy.
Totally. It can be super intimidating. It can be super intimidating, especially in the like gyms when like this man give you the look or something. But don't worry, if you're the trainer, you're not there alone. As a trainer, I'm willing to slap anyone who give me bad look and like call them away. But really don't be scared, because there's always something which can be done for you, which can ease your potential pain, which can make you feel better, loosen up your joints, and just it will be also the time only for you.
Yeah, I think this is a great point also to mention that we can do really lots of stuff to ourselves in our home. Yeah, so during the lockdown, like now, or we're just sitting at home, and you can train me online, because this is the way as it is for now, and
it works fine. People are surprised, but the virtual, this kind of training, it really works fine.
This is great. I think that technology led us to the moment that we can do
save us.
Yeah, so this is really positive from that situation. And you just mentioned that our posture is changing all the time, during pregnancy. Yes, I can confirm that from and we have some muscles that started to be a little bit weaker. Some of them start to be even contracted. So we have a pain somewhere, and something like that. Could you just explain us a little bit more why this is a situation like that, or what can we do?
I could put some light on it, but don't get me wrong, it's a very wide and deep topic what's going on there. But generally, as I stood up just a few seconds ago, let me do it again. From position when shoulder blade I squeeze, here, pelvic, this is called pelvic tilt. So pelvic is tilted on me, hop, we're getting this. Oh, my hair aside, slouch shoulder, bigger lordosis, we call it bigger lordosis, belly goes here, big, right? Here is slouch, we like lean back, not to fall, and my knees go inside, and I'm just going like a bit back here, like, right? That's what happens. So just in the easiest way possible, if I can explain it, this muscles, like I just say this muscles, all right, not like pectoralis or whatever. This muscle gets too tight, so we need to stretch these muscles. We need to strengthen these muscles here, so upper back, rotator cuff, in case to get this. We need to loosen up lower back, strengthen as well, don't get me wrong, but loosen up, so a lot of like mobility, Swiss ball, rotations, and lots of other strategies. Loosen up and thoroughly work on the strength of our core, which is not sit up. The strength of our core will be proper breathing, because on exhale, our core is contracting. So it will be the workout already for your core, and lots of different exercises too. And other part will be strengthening your glutes here, this area, as well as stretching them. So both with strengthening and stretching them. It's honestly, it's like the more overall I can say. And now I could throw you some certain exercises, but while talking, you won't know probably what am I talking about. That's why I do have some, again, on my Instagram. I can post a link to a few of them, not all of them, but that's why you have your trainers. Again, I'm really encouraging you to reach out to the professionals. So to get this at least 5 exercises which are tailored for you. For Louisa has this issue, this fitness fitness journey of her.
Was the journey, yes.
Yeah, exactly. And this will be 5 exercises for you. It can be cost of 1 session or maybe even less. Like really, we are there to help you. And I can just tell you this in the shortest because it's really the deep topic. But stretch, strengthen, strengthen, stretch, strengthen, and stretch. If yeah, I can also post a few graphics just to also overview what's going on with the lady. It's much more of these changes, but just if you remember at least that, to strengthen yourself, carry yourself proud. Exactly,
Yes,
be proud, because moms to be as well. You are superheroes. You are superheroes to me. Like, and I would do anything like to support them. Like always preaching it like superheroes. So yeah, that's the shortest I can tell and the most overall.
I see that the topic is very complex one and very wide, and we can like see the trainings, the pregnancy from the healthy point of view, and maybe for the sum up our conversation, you can give us a few bullets. I know fix the bullets we need to remember from that, and what we should remember in the future, what we can do, what is the most important, the posture, for example, how we can make it better. What more we can like as a sum up for us?
Certainly, that's a very good idea. Let's do some recap. First, most important, doctors visit, doctor's consent, right? Asking about physical activity, yes. Rule 1, always. If we get green light from the doctor, great. Second thing, women's health physio. Second trimester during pregnancy, 6-8 weeks after pregnancy, both to find the strategies, what we could, should, shouldn't do about our pelvic floor, and diastasis recti, which is separation of the abdominal muscle. We didn't talk about this one. This is normal during pregnancy. Let me just clarify on this one. Separation is normal. The problem only starts if after pregnancy, this distance was bigger than physiological, and there's no tension on the linea alba. You might have always distance, but if you have tension, which is functional, you'll be fine. But also, it's not only aesthetic issue, it's functional issue. And finally, people are talking about this. It's affect whole body. It also can affect incontinence. So that's why we go to women's health physio. The way you're standing up and from the floor, from the sofa, from the bed, and sitting down, always through the side, always. Practicing diaphragm breathing whenever you are. Inhale through the nose, exhale through the mouth. And then later, maybe on the birth school, they can teach you about the labor breathing. It's different thing. We lifting things from the floor on exhale. If it's squat, we stand up from the squat on exhale. If it's lunge, we go up on exhale. If you lift your baby, you lift on exhale. You lift shopping back on exhale. You lift yourself from the chair or seated position on exhale. Always. So we work against gravity, against some resistance, which is called exertion. Exhale on exertion. That's always. Try to align yourself, so straighten yourself and bend your knees to be more smooth and jumpy as much as you can, as much as you remember. Another general rules: go to the walks. Try to be maybe near this 150 minutes of, let's call it, even walks a week, right? So this 20 minutes, 30 a day, fresh air.
As possible.
Yes, just general active. But as I said, walks is the best example. So-called get your steps in, right? And last but not least, I guess, listen to your body. Of course, after the doctor, the first most important thing is yourself, because you've been living with your body for this X amount of years and you know yourself the best. So if your body really tells you that you're knackered, don't be like, oh, Paulina told you I need to do 20 minutes of work. No, just rest. Just listen to your body, because your body and you should like really work simultaneously. And if you're tired, just lay down. But try really to bring this.
I think this is good. As you mentioned, we just talked. Do not put any pressure on yourself because there's no always necessary, really.
No, you are already growing a human being inside. It's you're badass enough, really.
Okay.
Yeah, and oh yeah, exactly. You're badass moms to be, and moms, like, honestly. But the one which we mentioned before, also rest on your forearms, on your knees with the bum up. It just taking off pressure of the pelvic floor muscles. So these are just the genuine guidelines I could give to fairly everyone with the healthy and like regular pregnancy with green light from the doctor. Something very general. The rest will be more individual and tailored.
Yeah. Okay, I think you just bring us a little bit, not a little bit, but a huge amount of knowledge here. Thank you for that.
I still feel like I didn't say anything because the amount of things I would like to tell you.
Yeah, I can imagine that we can still talk for the hours about that. But I think we have like a few things we need to remember, a few things we need to know when we are pregnant or after one. And, for now, I know with whom I can contact, with should I can contact. And that's a most important thing. So thank you for that.
Thank you.
This is your goal, I think, to bring the knowledge to pregnant lady and woman.
On the mission.
The mission. So great to have that mission, and thank you for that. And keep going.
Yes, yeah, I will. Like, you don't going anywhere. We have still sessions this week. But yeah, as you say, I'm on the mission, but you are on the mission too, because you are talking to your friends, pregnant, future pregnant, or their partners. You just preach around too, and that's the most important. The more women will hear about women's health physio, MOT check, pelvic floor muscles, diastasis recti, and physical activity in pregnancy, after pregnancy, I think the better, because it will be just spreading and spreading more over, which finally the women will get attention which they really require and need.
This is a great sum up, I think.
Hopefully.
For that, and have a nice day still.
You too. Keep up, straight, and keep breathing. Diaphragm breathing.
So bye.
Thank you so much for this. Bye bye.